Yeah, this is a new research project. It's funded by the Wellcome Trust. It's a 5-year project looking at sexual violence, medicine, and psychiatry. So the basic aim of this project is to take sexual violence out of this kind of little box that it's in, which is called crime, and put it into this massive field, which is called public health. Because, I mean, one of the really striking things when you think about the history of sexual violence is the huge impact that medical professionals of a vast array of types actually have on the outcome and the treatment of victims as well as perpetrators. So what this project does is it looks historically. I'm an historian, so I go from the late 18th century right up until the present, and it looks at the way medical professionals have dealt with rape victims, how they have treated them, how they have given evidence in court. It also looks at perpetrators and sort of the psychiatry and psychology of perpetration behavior, as well as the way families respond when a rape victim comes back home. One of the things I found really interesting was the way that nurses don't seem to be kind of written in to the historical story about sexual violence. You know, we hear a lot about police surgeons, we hear an awful lot about forensic medical examiners, we hear a lot about psychiatrists and the way they have dealt with this issue of sexual violence. And actually we don't hear much about nurses. And that's actually quite surprising, because if you look historically, as well as, of course, the present, nurses are there. You know, 19th century, basically one of the first things that happened when a woman or a girl reports being sexually assaulted is they call in the midwife to examine the victim, or they call in a nurse, a local nurse, a public health nurse, to examine the victim. You also find that in court trials, often just as a little sort of phrase, they say, and nurse so-and-so led the victim from the court crying, when things don't go her way. So they are there, but they have been written out. And they are there very, very publicly, really only from the 1970s onwards. And so what I want to do is actually trace their involvement right from the late 18th century to the present. What is particularly important, I think, when you look at the nursing role is just how important their role was. That, they have been written out, but they are there all the time. And they tend to be much more sympathetic and believing of victims than your typically male physician. Particularly, of course, police surgeons, what are now called forensic medical examiners. Police surgeons were very hostile to rape victims, traditionally, historically. And the nurses tend to be a counterpoint to that role. They also tend to be much more important in dealing with the emotional side effects of sexual assault. And indeed, as I talk about in my lecture, nurses were responsible for inventing the term rape trauma syndrome, which has had a profound effect on the medical treatment of rape victims. I think nurses today actually can learn a lot from history, because what history teaches us is that nurses only got where they are by fighting, by lobbying, by saying no to authority, and by actually taking authority themselves. And I think that's a really, really important lesson for us today, because of course things are still not perfect in terms of the way the medical profession, the legal profession deal with rape victims. And so that need to continue sort of pressing for improvements and for change is something that we still experience. And looking at the way nurses did in the past, I think is really helpful and interesting. Gender is really important to the story I'm telling because male police surgeons were an extremely masculine occupation. There's one woman police surgeon to 8 male police surgeons in the 1950s and 60s. The police surgeons in that period tended to be from the military or from the Navy. They tended to also come from prison service. They also tended to be men who weren't doctors, who weren't really succeeding in their private practice, mainly because very, very successful doctors didn't want to do the job. You know, it's a job that's very, very poorly paid. Generally, you have to do it at very, very late at night and in the early hours of the morning. It takes up a lot of time, and indeed, you could be in court for days, weeks, months, even years on some of these cases. So the type of doctors who chose to do police surgery actually tended to be ones who were less sympathetic to the women, and it was largely women, it has to be said, who came in as victims. Whereas nurses, one of the things, language is important. One of the things I really found interesting is the police surgeons and male physicians talk about the victims or alleged victims, whereas the nurses call them patients. And I think that just says everything about compassion, about believing victims, and about the role of being a nurse.